Hi, I'm Shelby. I'll be your nurse today. Can you tell me your name and full date of birth, please? Okay. I'm verifying the patient's orders. Do you have any allergies to latex, shellfish, chlorhexidine, or iodine? Okay. I'm providing privacy. I'm washing my hands. Today I'm going to be inserting a catheter into your bladder to drain the urine. Afterwards, I will remove it per the physician's orders. Do you have any questions for me? And do I have your consent? Alrighty. So here's my patient. Okay. I'm cleaning off the perianal area. The bed is at hip level. I'm assessing the patient for any bladder distension, perianal redness, sores, rashes. Everything looks good. I'm going to position the patient into a supine position with the knees flexed and at the head of the bed to what is comfortable for the patient. I'm going to ask them to move their ankles up and their knees out to the side. I will lower the side rail on the side that I'm working on. I'm going to wash my hands. So right now I'm going to take out my sterile field. I'm going to save this for any trash that I have later. Discard. This is part of my sterile field. Extra space. Okay, so I'm going to open it away from my body. Sides, middle. I'm not going to use this. I'm going to just put that over here. Okay, so I'm going to, this kit would be all in between the patient's legs. I'm going to move this over to the corner. Have my sterile gloves. This is the cuff end. Okay, so I'm going to, this is my patient. I'm going to inform, oh, first I need to put my sterile gloves on. Making sure I'm only touching the outer corners of this to make sure it stays sterile. I'm going to pick a sterile hand, which is going to be my dominant hand, which is my right. Patients here, I'm in between her legs. So with my non-dominant hand, I'm going to spread the labia minora, and I'm going to use a saline or antiseptic soaked cotton ball. I'm going to clean in downward strokes from front to back, making sure to not reuse the same cotton ball. I'm going to clean the labial folds and then directly over the urinary meatus. And then I'm going to, with my sterile hand, I'm going to curl this up. I'm going to lubricate the catheter backwards in my sterile tray, so I will lubricate backwards so the lubrication doesn't get caught in the middle. I'm going to inform the patient that they are going to feel some pressure. I'm going to insert the catheter into the urethra, and I'm going to advance it until I see a flash of urine, and then I'm going to insert it a couple more inches before filling the balloon and make sure it is in place. So I'm going to hold on to the catheter with my non-dominant hand. And I'm going to inflate the balloon. And then I'm going to, after the balloon is inflated, I'm going to very gently pull on it to make sure that it is in the correct position. And it is in the correct position. I'm going to take off my gloves. I'm going to discard them. I'm going to perform hand hygiene. I'm going to tape this to the inside of the patient's thigh. And I'm going to make sure the drainage system is below the patient's bladder level on a stationary part of the bed. And then I would also make sure the perianal area was clean and dry at this point. And then now for the removal, I will perform hand hygiene. I am going to inform the patient that I'm going to be removing the catheter. First, I will remove the tape or the device that it is attached with. I will remove the air with a syringe from the balloon. Make sure it is completely deflated, and then I will have, with my gloves on, I will have the patient exhale while I pull the catheter gently. As the patient exhales, I will observe the catheter for any blood, mucus, or signs of infection. I will put that down. I will remove my gloves, throw them into the trash, wash my hands, and I will put clean gloves on again. I'm going to then measure the urine, and then I'm going to discard those supplies, and then I will raise the side rail, wash my hands, make sure the bed is in the lowest position, locked, call light is on, and I will wash my hands again. Thank you.